Welcome to yet another edition of COVID-19. I'm Min Sanhi. While acknowledging that the world is facing its worst healthcare crisis, the World Health Organization has also highlighted effective strategies by countries including Korea to contain the pandemic. We begin today with the headlines, with the figures that is, on the pandemic with our Kwon So-ah and related news with our Kim Da-mi. So what are the figures for this Tuesday here in Korea looking like?
Well, Sunny, we have a slight increase in new COVID-19 cases. However, locally transmitted cases have been on the decline. In fact, we only have 5 local transmissions today out of the 28. That means most of them are imported cases. The total stands at 14,203, and we have 1 additional death, raising the death toll to 300. And with that, the death rate is at 2.1%. Meanwhile, over 100 people have recovered in the span of a day, bringing the recovery to 13,007. And the recovery rate here in Korea is now at almost 92%. Now, it is a relief to see the numbers down to the 20s after we had 40s, 60s, and even 3-digit figures. But again, cases from abroad remain a concern. So if we go over to our map, in fact, we only have 3 local transmissions in the capital, Seoul, 1 in Gyeonggi province, and 1 down in Busan, which means the rest of these cases are all cases from abroad.
So it is comforting to see that domestic cases are dropping, but the situation elsewhere around the world is severe, and the WHO is expected to hold an emergency meeting later this week.
Right, Sunny. The WHO is to reconvene the committee later this week to reassess the pandemic. As Director General Tedros Adhanom Ghebreyesus says, COVID-19 is the most severe global health emergency that the organization has ever declared, and that as the cases have roughly doubled over the past 6 weeks. And that's also evident in the numbers that we're seeing here on our next table. Almost more than 16.6 million cases with some 230,000 new infections and over 656,000 fatalities and 10.2 million recoveries. And now let's move over to the major outbreaks. Here, of course, the U.S. on top with 4.4 million cases and over 150,000 fatalities. And even U.S. President Donald Trump's national security advisor, Robert O'Brien, has been recently tested positive with the virus. Now, it's not looking good here in Brazil at 2.4 million and India at almost 1.5 million total infections. Let's move over to other places. Some 10,000 new cases have been added in Peru. That's now at almost 390,000 infections, and the UK now has surpassed the 300,000 mark. Now, meanwhile, countries that are no longer on this list of major outbreaks have been praised by the WHO chief on the Monday for bringing large outbreaks under control, and that includes Canada, China, and Germany, as well as Korea. And I'll be back with more updates on Korea after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. On the local front, many sporting events across the globe have either been cancelled or postponed amid the pandemic. But here in Korea, the Professional Baseball League is opening its stadiums to spectators, albeit in limited capacity. I have our Kim Da-mi here in the studio with me for more on the new normal in the sports arena. Welcome, Da-mi.
Good afternoon, Sunny.
Now, Da-mi, news of baseball stadiums opening doors was met with much joy, I'm sure, by fans nationwide. Tell us more.
So 2 months into the season, South Korea's Professional Baseball League successfully played its first games with fans in the stadium. A total of 5 venues, including 2 in Seoul, 1 in Suwon, were open to spectators this past weekend. Fans, of course, jumped at the opportunity, with tickets in Seoul selling out in just under 1 minute, and 90% of those tickets in Suwon were sold.
And excited to finally see a baseball game in person.
Under the government's latest COVID-19 guidelines, stadiums had to limit spectators to only 10% of their capacity. So at Jamsil Baseball Stadium here in the capital, out of 25,000 seats, only 2,500 were filled. And all tickets were sold in advance online to allow staff to trace visitors in case of an outbreak. For that same purpose, all visitors had to check in by scanning a QR code. The electronic register is easy enough to be used by anyone. And foreign media outlets also praised the reopening of the country's professional baseball league. Sharing live coverage of a game at Tamsil Stadium, ESPN said Korea's hosting of spectators was a victory for the league.
Right, Tammy. Now, I'm sure the atmosphere was more lively with fans in the stands, but strict precautions, I hear, were also in place there. Please tell us more about the league's measures to prevent an outbreak at the stadiums.
Right. So first of all, spectators are not allowed to sit next to each other. And unfortunately, it's going to be a lot harder to enjoy Korea's unique culture of dining and cheering at the stadium. To prevent the spread of any droplets, eating is restricted, including the country's most popular ball game snack of chicken and beer. And visitors are allowed to eat, but only in designated areas. And they're also prohibited from singing and chanting in groups.
Normally, I'll be sitting next to my friend, chanting with her and eating snacks. We can't do that today, but I'm still happy that I can see the game.
There'll be cheerleaders, however, dancing to a medley of songs. Of course, during the game, face masks are mandatory at all times. This rule applies to the cheerleaders as well. And all these guidelines are posted up on the scoreboard as a constant reminder. And despite all these new restrictions, the presence of fans means a lot to the players on the field.
Fans have to sit apart from one another and are not allowed to cheer in groups. But the players are so thankful because fans coming to the game means a lot to us.
I'm sure it does. Dami, what's the plan for other sports? Do they also plan on welcoming back spectators, that is, in the near future?
So other professional sports leagues are following baseball's lead. And the K-League will welcome back soccer fans on August 1st, and they will gradually expand the number of spectators depending on the pandemic situation. The same rule applies, including temperature checks, wearing of masks, and social distancing. And there'll be no offline gatherings, including fan signing events. And the K-League has prepared guidelines and preventive measures in case of any emergency.
Players whose body temperature is 37.5 degrees Celsius or higher right before the game will have to wait 5 minutes and recheck their temperature. If it stays the same, the player will have to return home.
And players who've come in contact with a COVID-19 case will be put in self-quarantine for at least 2 weeks. And teams will have to postpone their games for at least 2 weeks if any one of their players come in contact with a COVID-19 patient. And unfortunately for golf, fans will have to wait until the end of next month for more details on how the tour plans to welcome back guidelines.
Right. Now, aside from the sports arena, public facilities including museums, art galleries and libraries have also reopened in the Seoul metropolitan area. Tami, please tell us more.
So after being shut down for more than a month, cultural and art venues are finally open here in Seoul. But just like sports, they must only allow a certain number of visitors to prevent overcrowding. Now, the QR code verification system comes in handy once again to monitor visitors. Of course, visitors are asked to abide by strict disease preventive measures.
In the early stages, facilities should limit the number of visitors, introduce an electronic registration system, and visitors are asked to wear face masks. We'll allow more visitors in faces.
10 major museums, including the National Museum of Korea, are only letting in up to 30% of its maximum capacity, and reservations must be made in advance. And 8 other art venues, like the National Theatre of Korea, are limiting the number of people allowed to 50% of their capacity. But nonetheless, people are happy to be back and are slowly but surely adapting to the new normal.
All right, Tami, thank you for that report. Hope to see you again back soon.
My pleasure.
Right, we are now poised to join the regular government briefing on COVID-19 here in Korea. Health officials here have compared the ongoing global battle against the pandemic to a marathon as opposed to a sprint. Accordingly, they are reportedly making changes to containment measures to help the system sustainable, that is, for the long run ahead. Officials have also identified 3 major risk factors in their latest efforts against the outbreak. Now, these include the surge in global spread, the upcoming summer holiday here in Korea as local schools are set to end their semesters in the first week of August, and the vulnerability of the elderly to the virus. And with regard to the latter, authorities are calling for more stringent preventative measures at the country's nursing homes and other CAF centres. And on the subject of prevention, starting from this week, travellers from high-risk nations will be tested twice within 2 weeks of their arrival before they are allowed into the local community. This precaution comes amid a rise in import cases. The briefing is about to start. We'll come back to you afterwards.
First, here is Director Chung Eun-kyung with the explanation. Let us now begin our regular briefing for the COVID-19 situation here in South Korea. As of July 28th, we have a total of 5 new local infections today and 23 new imported cases. And now the accumulated number of confirmed cases stands at 14,203. 102 more people have been discharged, while that means that 91.6% have been discharged. 896 people remain in quarantine. The number of patients with critical conditions stands at 12, and we had 1 additional fatality, with the death toll increasing to 300 and the fatality rate at 2.11%. I extend my deepest condolences to the bereaved families. Here are some major updates on our domestic infections. In relation to the Sinmyeong investment in the Jongno-gu district, Seoul City, we have additional case there, and now the confirmed case stands at 10. And in relation to a Jin group in the Songpa-gu district, Seoul City, we also had the first index case on the 23rd, and now the confirmed case total of number of confirmed case stands at 7. In relation to the Seoul government complex, we have been conducting the testings for those who have been coming into close contact, and all of the 171 people who have been working there have been completed testings, and also the visitors will be tested as well, and we are currently conducting the epidemiological investigation. And in relation to a Russian vessel at the Sinsan port in Busan, we also have 1 more person being confirmed, and now the number of confirmed cases in the community stands at 10. Here are some updates on the imported cases. Yesterday, we had a total of 23 new imported cases, and 10 of them have been reported at the points of entry, while another 13 of them have been reported while they were on self-quarantine. 14 were South Koreans, while 9 of them were foreigners. The KSDC, starting from this week, we are seeing that the students are going into their summer holidays and vacations, and we have been exerting our full efforts so that we can keep the quarantine measures for the students. And starting from the May, we have confirmed that about 100 patients in the age of from 3 to 18 have been confirmed, and also we have confirmed that those between the age of 16 and 18 or 13. And major sources of infection were 60% of them were through family transmissions, and also these on the second list, 18 or 16.3% were from the private academies, and also there were about 9 people who have been infected through multi-use facilities, and 1 case has been related to a school transmission. And during the summer holidays, we believe that many students will be going to PC rooms and private academies, and we believe that we could see some blind spots of quarantine. We need to effectively prohibit the COVID-19 transmissions among children, and here are some 3 do's and 3 don'ts that our students need to remember at all times. First, 3 do's are as follows. First, when you are using transportation transportation, public transportation, or when you are indoors, please wear your face mask. And when you are wearing face mask, you need to cover up your nose and your mouth, and do not touch the surface of the mask, and please wash your hands on a regular basis. And second, you need to disinfect your hands with disinfectants, and also you need to wash your hands for over 30 seconds with soap and water, and also keep a healthy distance with others. And 3 don'ts are as follows. First, if you feel sick, if you have symptoms like fever or respiratory symptoms, you shall not go outside. And you should also refrain from going to crowded and enclosed spaces like PC rooms and singing rooms, and do not touch your face with contaminated hands. And these are also very important for the general public as well. And you need to also remember at all times that COVID-19 spreads fast among a closed, crowded, close contact environment. This means that you shall avoid going to multi-use facilities like PC cafes and other crowded spaces. On a global level, we are seeing the COVID-19 pandemic centering around US, India, and Latin America, as well as South Africa. We have seen also Europe, which had seen a slight decrease in the number of COVID-19 cases. However, with the easing of lockdowns, we are seeing a resurgence of the virus, especially in France and Spain. And also Vietnam, Hong Kong, China, which have been praised for their early efforts to curb the virus. They are also intensifying their quarantine and strengthening their protection against borders because they are seeing a resurgence of the COVID-19 patients. And here in South Korea as well, we are going through 2 tracks of difficulties, first of which is local transmission, and second is the imported cases. We are seeing a local infections drop starting from yesterday. However, we shall never be complacent. It took over 2 months for us to effectively curb and contain the outbreak that stemmed from the Itaewon case in early May, and we shall always remember this. And this also led to the closure of many offices, many multi-use facilities, as well as schools. And thanks to the participation from the public, we have been avoiding a major outbreak. However, please remember at all times that COVID-19 spreads very fast, and it could spread especially via silent spreaders if we stay complacent. Starting from this week, many people will go on their summer holidays. We ask you to refrain from having close contact with others, and we believe that during these times of the year, we will see an increase of the risks of infection. We need to decrease the risk of infection, especially during summer holidays, so that our medical capacity will be able to manage a possible surge in the outbreak. This is the very first summer holiday and summer vacation after the COVID-19 pandemic, and please remember that you need to prioritize the safety and the health of not only yourself but also your family members. COVID-19 spreads very fast at closed, crowded, close contact environment, which also stands at a 3C environment. So please refrain from going to nightlife entertainment venues, and also make it a habit to wear your face mask and wash your hands. Thank you very much.
Right, that was Chung Kyung, the head of KCDC, with Tuesday's afternoon briefing. So, do give us a summary of the key announcements.
All right, well, let's begin with the imported cases. We have 23 imported cases today, out of which 10 were detected at the nation's airport or seaports, and the other 13 during the 2-week self-isolation period. And it looks like 14 were South Korean nationals and 9 were foreigners today. And due to a resurge of cases abroad, even in countries that have earlier been praised for their containment efforts, such as Singapore or Vietnam. Due to that, Tong called on continuous vigilance here in Korea as well, because imported cases are still on a rise and local transmissions are also still occurring. Meanwhile, as the summer vacation is just close up, she mentioned that there has been an assessment by the government on underage patients of COVID-19 between the age of 13 and 18. And And it looks like there were 111 patients in that age group past May, and more than 60% transmitted this COVID-19 among family members. So that's something we have to be careful about and also abide by the social distancing measures during vacation as well as holidays.
Right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
Strict entry procedures are in place at the nation's airports and seaports for all inbound passengers. Aside from checking on their physical conditions and requiring them to download mobile apps that monitor their health, Korea is also operating a special fleet of taxis to ferry them to their respective destinations. We have more in this next report.
Korea's disease prevention authorities are exerting their full efforts to protect the local community from imported COVID-19 cases.
전 세계적인 유행에 따라서 우리나라에도 해외 유입 확진자가 증가하고 있는 상황입니다.
Movement is restricted for those entering Korea through the country's seaports until they are tested negative for COVID-19. For people entering Korea by air, they must undergo special entry procedures, and their movement is closely monitored by the country's disease prevention authorities. Immediately upon entering Korea, air passengers must either drive their own personal vehicles or use a special shuttle bus. Regional governments in Seoul, Incheon, and Gyeonggi-do province are also operating special taxis to ferry inbound travelers to their destinations.
Well, our taxi starts at April 2nd until now, and our customers is 90% of Korean customers and 10% of foreigner customers. They thought that our taxi is very safe. That's why they all satisfaction with our taxi services.
Protective barriers are installed in these taxis to keep the drivers and passengers separated, and they are also equipped with hand sanitizers.
이거 해외에서 입국했는데 좀 되게 불안했는데 이런 것도 다 배치돼 있고 이런 가림막도 있어서 되게 좋은 것 같아요.
First of all, I feel a heavy sense of duty and responsibility in carrying out of this operation. And then first of all, we will go to the healthcare center and take you to the place for the self-isolation after receiving a COVID-19 test.
Upon leaving the airport, the taxis ferry the passengers to a designated screening center. The driver parks the vehicle outside and waits while the passenger undergoes testing. After that is complete, they are taken to their final destination, where they will stay in quarantine for 2 weeks. The taxis must then return to the airport and are prohibited from picking up other passengers.
출발 전과 또 모셔다 드리고 난 후에 꼭 이제 1일 2회씩 방역을 하고 또 운행토록 했고요. 그런 비용하고 뭐 칸막이 비용은 그렇고 마스크, 또 장갑, 뭐 세정제 모두 다 지원하였습니다.
The Seoul city government is currently operating 200 special taxis to ferry these passengers individually. These taxis are not only safe, but they also charge rates that are identical to ordinary cabs. Despite concerns over the rising number of imported cases, the drivers are approaching their jobs with a sense of purpose and duty.
사실 주변에서도 많이들 걱정하고 계십니다. 하지만 서울 시민을 지키고 있다라는 사명감으로 저희들이 이 일에 매진하고 있습니다.
Despite the continuing influx of COVID-19 cases from abroad, these special taxis are serving as the all-important first line of defense to protect local communities from imported cases.
모든 국민들이 낸 세금으로 그중에서도 소득이 많고 자산이 많은 사람이 더 많이 낸 세금으로 만든 정책이기 때문에 공평하게 일률적으로 집행하는 것이 가장 바람직하다고 생각합니다.
4차 산업혁명을 위한 여건 조성 아울러서 이로 인해서 파생되는 기본소득 문제를 근본적으로 검토할 시기가 아닌가 생각을 합니다.
The pandemic has been adding significant momentum to debates over welfare policies for the public. And one such debate is that over universal basic income. For more on this, I have Professor Kim Se-wan from Ewha Women's University here in the studio. Welcome, Professor Kim.
Good afternoon.
And I also have Professor Oh Jun-sok from Soomyang Women's University. Good to see you back, Professor Oh.
Thank you for having me.
Professor Kim, we'll start with you. Let's begin with what is meant by the phrase universal basic income and how it differs from existing welfare policies.
Well, the discussion of basic income has been started at the beginning of 21st century over fast-paced automation and globalization. And then the fourth industrial revolution and quite a few IT platform companies' monopolistic power in several industries accelerated the discussion over basic income further. Basic income is basically different from current supporting program on low-income people in that it pays certain amount of money to everyone without any qualifications. So that means everyone is paid a certain amount of money, fixed amount of money at regular basis, regardless of age, gender, education, and income, and so on.
I see. Professor, would you agree that now is the right time to adopt this policy, given the lack of jobs or inability to work, that is, amid the pandemic, which is also thus widening the income inequality?
Temporarily, yeah, I agree. The COVID-19 has not faded away yet, lingering longer than expected, which evaporating the purchasing power in the market. And then what about business? Business also has plummeted down, and then income inequality, as Professor Kim commented, that widened due to the disappearance of job opportunity, which might increase the social tension, and some people and the society will pay the social cost if it is not properly managed. In this end, that UBI, Universal Basic Income, is a kind of a way to lessen the pressure of the social cost. So I must say that it is right time to take a double check on the feasibility of the Universal Basic Income. But there is an argument, say, efficiency versus urgency. For the longer perspective, efficiency, I mean that restoring the market mechanism and then resource allocation through the market mechanism is the right answer. But it is a situation, that COVID-19 is a state of emergency. We are not talking about the health of the economy. We are talking about a patient who is choked now. Urgency is needed. So in a way, to wake up the economy, universal basic income might be one of the measures to take this kind of problems.
Right. Professor Kim, back in May, if I may, Koreans had a taste of universal basic income when the government handed out emergency funds to all its citizens to help them cope with COVID-19. What was the impact of that financial aid to members of the public?
I have to say that government's cash out program in May is successful in recovering domestic consumption and consumer sentiment. Due to government's cashing out program, May's consumption compared to previous months increased by 2% against the previous month's 2% contraction. So that has a big implication on total domestic expenditure because consumption covers almost 60% of total GDP or expenditure.
Now, for a broader perspective on this policy, we turn to Spain, where authorities have already ruled out a universal basic income in response to the pandemic. I have Professor Javier Morillas from the CEU San Pablo University live on the line. Welcome to the program, Professor Morillas.
Thanks to you.
Professor, I understand the basic income at present is being handed to the poorest households. How many households would that be, and how much are they each receiving?
Yeah, the government said that will be around 850,000 families, so around 2 million persons. 2 million persons in different kinds, in 14 different of families. For instance, a couple with 2 or 3 children, or a woman with one children or two, but around 2 million people. The government say, let's go to see during the next months, no?
Professor,
And the amount, no, you say about the amount. Yes, just now the government is 462 euros by person. And then a family with a couple with 2 or 3 children are exactly 1,015 euros by month during 12 months. Not, for instance, in Spain we have 14 pays, no, every month, and 2 extra paid during Christmas and during July. But in this case, is only by month. During 12 months, no, and is for the legal residents here in Spain only. Is necessary to be in Spain at least during the last year, 1 year at least, for unemployment people, of course. To have less than 65 years old and more than 23 years old.
Professor Murias, then the basic income initiative in practice in Spain right now is slightly different from the universal basic income plan, which calls for cash handouts to all its citizens then.
Well, the universal income is different. The situation, for instance, in the oil countries like Saudi Arabia or Kuwait or Emirates, so they have the universal income for their citizens because it's a rent from the oil and they pay a universal and a minimum, no, for the people. And only for the people from Emirates and only for the Saudi Arabians people and only from the Omanis people. So this is different. At the moment, it's not permanent. It's not permanent. So it's only theoretical. Let's go to see during the next 2 years. Let's go to see, no. But at the moment, it's not permanent. Only for unemployed people. And well, with these characteristics, no?
Professor Murias, now it might be too early to tell, but since this plan was put into practice last month, but have there been any tangible outcome from this initiative?
Well, I suppose in the short term will be a call effect for people from abroad, especially for immigrants. It's a problem. Perhaps we will see improve the black economy. The black work will be bigger. Well, it's a program that is necessary to see during the next 1 or 2 years to see like is in the normal life of the people, no? Because the problem is can be like the Indian reservations in the USA, no? Because kill the initiative to find a work for people. Let's go the experiment.
Professor, if you have a question you'd like to ask Professor Murias, please go ahead.
Professor Murias, good to see you. And people say, and I also do believe that there is no free lunch in economics. And then, as I know, Spain had faced a huge amount of budget deficit now due to COVID-19 outbreak. And then it is expected, according to a report, that 3 billion worth of euro is needed to operate a universal basic income system in Spain. And then my question is how to finance those huge amount of money without fear of inflation or stagflation?
Yeah, it's a good question because we are not in the right situation, no? So at least we have only 200,000 people with the minimum income, no? I think that at the end, for the government, will be difficult to establish this minimum income. Let's go to see, as I say, no. And in the other side, every regional government here in Spain, they have some provisional money every month also. So just now we can to have two incomes, two different incomes from the central government and from the regional government. So it's will be a problem, really.
Professor Kim, if you have an inquiry, please go ahead.
Professor Morias, I have a quick question about the role of Spanish government in implementing basic income in Spain. We were told that Spain is the first country that introduced basic income in Eurozone. What do you think is the most important factor and role of government for having successful result from basic income in Spain?
Well, it's the selection of the persons, no? This is the main problem. Must be provisional, must be a measure for emergency, not permanent. The selection is the main problem, no? And to have also care with the kind of people that came from abroad to take the money, then return. No? For instance, we have just now in Spain a lot of people with the ways for unemployment that every month come back to Morocco or come back to Romania every month, and they came here during the 10th of every month to pick up the money and then return and live in their country with that money, no? So let's go to see.
I see. Only time will tell then. All right, Professor Morias, thank you very much for sharing your thoughts with us and for making the time to join us live at this hour.
Okay, thanks to you. Bye.
Right, Professor, there are other countries worldwide that are experimenting with basic income. Can you tell us a bit more about these endeavors?
From the perspective of economists, the concept of universal basic income is not new. But the case of introducing universal basic income case is very rare. In economics, James Tobin, Milton Friedman, and then Herbert Simon is a distinguished economist. They also commented about and the need of a basic income. But there is no evidence or substantial proof about the effects, economic effects, which means that it could raise a multiplier effect or the causality between the basic income and creating job opportunity. It is not proved yet. So Northern European countries such as Finland and then Sweden, they, as an experiment, they tried to introducing this kind of universal basic income. In 2017, Finland, as an experiment, introduced universal basic income to the unemployed. And then in 2018, Sweden, they tried to start basic income to the low-income group of society. But the test result is not that significant. And then Kenya also had the same experiment, and then even the United States, they also tested. But the test result is not quite as sure. Here, I comment about what I comment about is that universal basic income itself does not increase or change the competitiveness or the capacity to survive in the market by themselves. What matters is to change their competitiveness. So in this sense, universal basic income, this is a kind of a temporary measure. It's not a long-term measure, I might say.
So it can't be permanent. I see. Professor Kim, Professor Oh had asked Professor Morias about whether Spain would be able to deal with the financial resources of supporting a basic income initiative. What is the case like for Korea? Are Korea's coffers able to accommodate a universal basic income policy?
Well, I'm glad that you raised that point, Sunny, because that is really a critical question related to basic income. The ultimate question in basic income goes to who's going to pay for it. So I think there are two different ways to finance basic income without hurting much of the health of the fiscal status of the country. The first is levying more taxes from high-income people and high-income, mostly IT companies who were benefited from Industrial Revolution these days. But there could be, of course, serious resistance from these people and companies. They can even, in the long run, move their companies to foreign countries. The second way to finance basic income is government can reshuffle all current programs that support the low-income people and recycle that financial resources to finance basic income. But in that case, government support on low-income people can be seriously weakened. So there should be something political and social decision for implementing basic income program.
So it has to be a comprehensive effort across all sectors of society.
Right.
Professor, if Korea were to adopt this universal basic income policy, how should the criteria detailing the eligible, for example, receivers be drawn up?
To make it short, that the simpler, the better. Universal basic income is a type of helicopter drop of money, which means hovering helicopter over the sky and then from the sky dropping the money. And then policymakers, they do know about the side effect of helicopter drop of money, which means increase the inflation. And then when dropping money over the long span of years, it could not raise the expected result. It is a matter of choice of effectiveness and practicality. To be effective, Spanish case might be have an edge. Narrowing down the target and then depending on the level of income, that group discrimination might be a good alternative. But in practicality, we know as a side effect of the kind of basic income system, there might be a risk of information asymmetry, and then a moral hazard might happen as time goes. In this sense, that if it were introduced in Korea, it should be temporary, and second, uniform type of basic income could be easier, something like 500,000 won per month per person might be feasible in a way to implement in time of urgency.
I see. Professor Kim, in what direction should Korea's basic income initiative flow if it were to adopt it to better suit it to the public here?
Actually, the details of basic income is very simple. Government pays a fixed amount of money to everybody. But still, between Korean people, there is something psychological resistance on basic income because many Korean people do not understand payment without working. So before implementing basic income program, there should be something, social agreements on basic income program. Otherwise, there could be lots of social conflicts between different group of people.
So first we need to find a consensus.
Exactly.
What, Professor Oh, would be your words of advice if Korea were to adopt the universal basic income?
If it were introduced, it should be temporal. And second, then as a prerequisite, that new tax base should be developed. Aftermath of COVID-19, digital economy, and then as Professor Kim commented about the automation and robotization, it might be a new source of tax revenue.
I see. And would you believe in having this income awarded to all members of society, or like Spain, should we decide to help the poorest people first?
From the perspective of economy, that narrow down zone to the low-income person.
That would be better. Do you share those thoughts, Professor Kim?
Well, I think the financial sources of the government for basic income can be focused on lower-income people instead spreading out all the money to everyone. I think that's the better and more efficient way to promoting domestic consumption and economy.
Instead of dropping it from the helicopter like Professor Oh mentioned.
Right.
All right, Professor Kim, thank you very much for your thoughts. And Professor Oh, as always, thank you for your thoughts.
Thank you for having me.
Thank you very much.
Right, well, that brings us to the end of this edition of COVID-19. Tomorrow, we take a look at new findings in the medical arena about the virus. In the meantime, do reach out to us with your thoughts and inquiries on our social media accounts or homepage, arirang.com. Thank you for watching.